In our effort to cut calories and reduce sugar, we turn to diet sodas and zero-sugar foods. We swap white sugar for low-calorie alternatives like aspartame, sucralose, and stevia. These artificial sweeteners provide the sweet taste we crave without the caloric payload. But a controversial question remains. Do these sugar substitutes trigger an insulin response? Today, we're going to look at the clinical research to separate biology from myth. To understand the concern, we must first look at how the body normally releases insulin. Under normal conditions, when we eat carbohydrates, they are broken down into glucose. Glucose enters the bloodstream, raising blood sugar levels. In response, the pancreas secretes insulin to help transport glucose into your cells. This is the primary pathway for insulin release in metabolic health. But there is also a secondary pathway called the cephalic phase insulin release. When sweet taste receptors on your tongue are activated, they send signals to the brain. Expecting glucose to arrive, the brain signals the pancreas to release a small amount of insulin. This anticipatory insulin release occurs before any nutrients actually enter the stomach. Because artificial sweeteners activate sweet taste receptors, some argue they trigger this cephalic release. If true, this could lead to elevated insulin levels without any incoming glucose. High insulin levels in the absence of sugar can cause blood glucose to drop too low. This drop in blood sugar can trigger intense hunger and cravings for real sugar. Over time, chronic spikes in insulin could contribute to insulin resistance. But what does the actual scientific evidence show in human clinical trials? Let's start with common chemical sweeteners like aspartame and acesulfame potassium. Multiple double-blind studies have tested these sweeteners in human subjects. The results are highly consistent. Aspartame does not trigger insulin release in humans. Even when consumed in high amounts, it has zero impact on blood glucose or insulin levels. Next, let's look at sucralose, the sweetener commonly known as Splenda. Here, the research is slightly more complex but still clear. Most studies show that acute consumption of sucralose does not affect insulin levels. However, some trials suggest that frequent daily use may slightly modify gut microbiome health. A compromised microbiome can indirectly affect glucose tolerance over the long term. Now, let's examine natural non-calorie options like stevia and monk fruit extract. Interestingly, clinical research on stevia shows promising metabolic benefits. Stevia does not increase insulin levels in healthy individuals. In fact, some studies show it can help lower post-meal insulin and glucose spikes. This makes stevia an excellent choice for individuals managing type 2 diabetes. What about sugar alcohols like erythritol, xylitol, and maltitol? Erythritol is absorbed in the small intestine and excreted unchanged in urine. It has a glycemic index of 0 and does not stimulate insulin secretion. Xylitol has a very low glycemic index and causes a negligible insulin response. However, maltitol has a higher glycemic index and can cause real spikes. Always check ingredient labels for maltitol if you're monitoring insulin. For the vast majority of sugar substitutes, the cephalic insulin phase is clinically insignificant. The human body is highly efficient at detecting the absence of actual calories. Using sweeteners in moderation is a safe tool for sugar reduction. But they should not be viewed as a free pass for poor eating habits. A diet rich in whole foods remains the ultimate foundation of metabolic health. Focus on reducing your overall threshold for sweet tastes over time. Stevia and erythritol are the safest choices for minimizing insulin impact. Limit processed diet products to support optimal gut health and digestion. Understanding hormone biology is key to making informed dietary choices. Empower your health journey by aligning your habits